Hello, I'm by the names of Moza Esther and I'm a student at Cape Town University. I was working on a goal called Utilize Healthcare Data, and in this goal there is a project that is called Electronic Health Records, which I had to make or create a speech video recording while I was asked to record the script that I have worked on it. In this record I have to answer some questions that I have asked in this project. The first question is asking to introduce EHRs. Electronic health records are the computer system that are used in health centers instead of using paper charts. This system helps to know patients' history of life and the ways of preventing his or her illness before she gets too bad. Also, these records kept in the private way, where the records known by health providers and patients himself or herself in a way of help involve your patients in their own care. Also, there are some functions for electronic health records, as it helps patients to involve in their way of curing. The first one is manage medication lists, refers to the creation of specific medication list of patients. Manage problem lists, which refers to all about the creation of specific problem lists of patients. Manage patients demographics, and this refers also to the way of maintaining patients' demographic information that's tracked in a good way in a given period of time. Identify and maintain a patient records also refers to the maintain of patient's records for each patient accordingly. Then EHR helps in several ways, as it is easy the communication among patients and health providers, and patients get all information they need on their life, and their information are recorded and kept for their life purpose. Also, this helps to maintain information of patients, as it avoids repetitions of taking tests for patients. Also, services are provided in effective way, as it takes a short time of period, and that helps to access patients' information and update them in case patient comes for another health service. This also may reduce time they used to spend at the hospitals, and help patients to keep checking their life, their well-being. Also, this helps patients to maintain their lifestyle and maintain their well-being, and take precaution of any problem they can meet with that related to their life. Also, in addition to that, there is components, as another question below. Components of EHRs that support direct clinical care and explain associated benefits and issues. In this part, patient management components refers to the required for patient registration, transfer, discharge, and admission functionality. This also helps doctors to get enough information of patients, which may help them to provide effective services to those patients in order to take a short of time while they are at the hospital without spending a lot of time for refiling other health documents. Also, laboratory components, radiology information system and billing system, which helps health providers to capture lab results and recording tests accordingly. Also, it helps health providers to provide effective services to their patients as it is needed, as I have said above. Also, there is some components of EHR that support administrative processes. Support administrative process is a process of office tasks that are required to keep hospitals data, which include administrative process include marketing, accounting, and human resources in order to provide more timely services to their patients and improve hospitals productivity in a short time. Also, population and reporting health. This refers to the way of maintaining patients' health from healthcare providers by checking several times about the life of their patients and respond to the quick request from their patients in order to provide effective services. Also, this helps patients to have their own ability of arranging the services or to meet with a doctor. It also helps patients to prevent future health problems they can meet with and find precaution of those problems that they can meet with ahead of time, because they get enough time to meet with doctors and make some checkups of their body in order to prevent any health issue can take place to their life. Also, admission discharge transfer system also refers to the process of confirming and checking the transfer of patients that's transferred from one health center to another one. This system helps hospital administrations to track all actions that has taken place to patients since she or he reaches to the hospital and provide effective services to him or her in order to maintain their effective services and get more more people who can join them in order to increase their profitability as well. The following is importance of the integration of administrative and clinical areas of effective use of EHR. As healthcare organization, some challenges that they meet is the increasingly more data in exchange beginnings of significant use. Many are focusing on electronic health record integration projects for improved flow of clinic data to enable better care coordinations across the healthcare field. This is where healthcare providers spend a lot of time on electronic information and computers instead of taking care of patients they have. Clinical outcomes include improvements in the quality of care. This comes to the effectiveness, patient safety, and effectiveness where EHR focus on these outcomes of hospitals, which can boost their performance, provide effective services to the patients. Reduction in medical errors also, it's another importance. This comes to the way of reducing some test errors to happens that is usually happens in labs, which cause the repeating in the tests now, which and take a lot of time and delay to the action of getting effective services, and reduce medication errors to the hospitals. The last but not least is the benefits of EHR. It saves time as it reduces the spend at the hospital, the spend time patients spend at the hospital while filling health documents, and sometimes lose them, which there's the services they may get in a short period of time. It helps also to keep track of patient co-pays and other payments, as well as search your entire patient populations to identify patients who are delinquent on payments. Another benefit is that also it helps reviewing the schedules for multiple healthcare providers and practice locations on the same screen. In addition to that, it helps to schedule appointments electronically using the system calendar by entering all details into the computer, such as the reasons for the visit, how that action would take place, as well as scheduling the doctor who would help that patient who have appointment, who ask the patient without taking a lot of time waiting the doctors. This also saves the time as everything arranged in effective ways. Thank you very much for listening to me.